Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
When teaching a prima gravida client with diabetes about common causes of hyperglycemia during pregnancy, which of the following would a nurse include? 1. Fetal macrosomia. 2. Obesity before conception. 3. Maternal infection. 4. Pregnancy-induced hypertension. The correct answer is 3. Maternal infection is the most common cause of maternal hyperglycemia and can lead to ketoacidosis, coma, and death. The client should notify the primary healthcare provider immediately if she experiences symptoms of an infection. Fetal macrosomia, obesity before conception, and pregnancy-induced hypertension are not associated with maternal hyperglycemia during pregnancy. A client admitted with a diagnosis of schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, and olanzapine prescribed has had an increase in manic symptoms in the past week. The psychiatrist prescribes a valproic acid blood level to be drawn at once. The nurse understands the rationale for this prescription, as which of the following? 1. All clients taking valproic acid need periodic valproic acid levels drawn. 2. Fluoxetine can decrease the effectiveness of the valproic acid. 3. A decrease in the level of valproic acid could explain the increase in manic symptoms. 4. The valproic acid level is needed before a short course of lorazepam for agitation can be prescribed. The correct answer is 3. Valproic acid is commonly used to treat manic symptoms. Therefore, a decrease in the valproic acid level could explain the increase in manic symptoms. Periodic determinations of the valproic acid level are necessary to determine the effectiveness of the drug. However, the stat nature of the specimen to be drawn indicates an immediate problem. Fluoxetine is not known to decrease the effectiveness of valproic acid. The valproic acid level is not needed before beginning a short course of therapy with lorazepam. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset." The primary healthcare provider says, "I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment? 1. Boy, I have a lot to think about before I see the social worker tomorrow. 2. I think I can handle most of Dad's needs with the help of some home health care. 3. I'm so afraid of making the wrong decision, but I can move him later if I need to. 4. I want the social worker to make this decision so Dad won't blame me. The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. The other responses convey that the son understands the importance of a careful decision, the availability of resources, and the ability to make new plans if needed. On arrival at the emergency department, a client tells a nurse that she suspects that she may be pregnant, but has been having a small amount of bleeding and has severe pain in the lower abdomen. The client's blood pressure is 70/50, and her pulse rate is 120 beats per minute. The nurse notifies the primary healthcare provider immediately because of the possibility of 1. Ectopic pregnancy. 2. Abruptio placentae. 3. Gestational trophoblastic disease. 4. Complete abortion. The correct answer is 1. The client's signs and symptoms indicate a probable ectopic pregnancy, which can be confirmed by ultrasound examination or by cholecystosis. The primary healthcare provider is notified immediately because hypovolemic shock may develop without external bleeding. Once the fallopian tube ruptures, blood will enter the pelvic cavity, resulting in shock. Abruptio placentae would be manifested by a board-like uterus in the 3rd trimester. Gestational trophoblastic disease would be suspected if the client exhibited no fetal heart rate and symptoms of pregnancy-induced hypertension before 20 weeks gestation. A client with complete abortion would exhibit a normal pulse and blood pressure with scant vaginal bleeding. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb one flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from the trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. When caring for a client with a chest tube and water-sealed drainage system, the nurse should 1. Verify that the air vent on the water-sealed drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative intrapleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. Petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. A client has been in an automobile accident, and the nurse is assessing the client for possible pneumothorax. The nurse should assess the client for 1. Sudden sharp chest pain. 2. Wheezing breath sounds over affected side. 3. Hemoptysis. 4. Cyanosis. The correct answer is 1. Pneumothorax signs and symptoms include sudden, sharp chest pain, tachypnea, and tachycardia. Other signs and symptoms include diminished or absent breath sounds over the affected lung, anxiety, and restlessness. Breath sounds are diminished or absent over the affected side. Hemoptysis and cyanosis are not typically present with a moderate pneumothorax. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity. 2. Ataxia. 3. Cystitis. 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. Which of the following medication prescriptions to help relieve discomfort in a child with leukemia should the nurse question? 1. Hydromorphone. 2. Acetaminophen with codeine. 3. Ibuprofen. 4. Acetaminophen with hydrocodone. The correct answer is 3. Ibuprofen prolongs bleeding time and is contraindicated in clients with leukemia. Non-narcotic drugs other than ibuprofen or aspirin, such as acetaminophen, may be prescribed to control pain and may be used in combination with codeine or hydrocodone if pain is more severe. Hydromorphone may also be used for severe pain. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of diseases for which they are being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. The nurse is transferring a child who has had open heart surgery from the intensive care unit to the pediatric unit. The child's blood pressure has been fluctuating, but has been stable during the last 2 hours. The nurse from the pediatric intensive care unit should include which of the following information in the report to the nurse on the pediatric unit? Select all that apply. 1. Medications being used. 2. Current vital signs. 3. Potential for blood pressure to drop. 4. Drip rate for the intravenous infusion. 5. Time of the most recent dose of pain medication. 6. Medications given during surgery. The correct answers are 1, 2, 3, 4, and 5. The report made when nurses are handing off a client from one nursing unit to another must include information about the condition of the client, potential for changes in client's condition, current medications, and care and services received. It is not necessary to know what medications were given in surgery to provide safe care at this point. Before we move on to the next question, The NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following should the nurse include when completing discharge instructions for the parents of a 12-month-old child diagnosed with Kawasaki disease and being discharged home? 1. Offer the child extra fluids every 2 hours for 2 weeks. 2. Take the child's temperature daily for several days. 3. Check the child blood pressure daily until the follow-up appointment. 4. Call the primary healthcare provider if the irritability lasts for 2 more weeks. The correct answer is 2. The child's temperature should be taken daily for several days after discharge because recurrent fever may develop. Offering the child fluids every 2 hours is not necessary. Doing so increases a child's risk for CHF. Checking the child's blood pressure at home usually is not included as part of the discharge instructions because by the time of discharge, the child is considered stable and the risk for cardiac problems is minimal. Most children with KD recover fully. Irritability may last for 2 months after discharge. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important? 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage because a surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present. A prima gravida client is admitted as an outpatient for an external cephalic version. The nurse should assess the client for which of the following contraindications for procedure? 1. Multiple gestation. 2. Breech presentation. 3. Maternal Rh-negative blood type. 4. History of gestational diabetes. The correct answer is 1. External cephalic version is the turning of the fetus from a breech position to the vertex position to prevent the need for cesarean birth. Genital pressure is used to rotate the fetus in a forward direction to a cephalic lie. Contraindications to the procedure include multiple gestation because of the potential for fetal injury or uterine injury, severe oligohydramnios, contraindications to a vaginal birth, and unexplained third trimester bleeding. If the mother has Rh-negative blood type, the procedure can be performed and Rh immunoglobulin should be administered in case minimal bleeding occurs. A history of gestational diabetes is not a contraindication unless the fetus is large for gestational age and the client has cephalopelvic disproportion. A diagnosis of hemophilia A is confirmed in an infant. Which of the following instructions should the nurse provide to parents as the infant becomes more mobile and starts to crawl? 1. Administer 1/2 of a children's aspirin for a temperature higher than 101 degrees Fahrenheit. 2. Sew thick padding into the elbows and knees of the child's clothing. 3. Check the color of the child's urine every day. 4. Expect the eruption of the primary teeth to produce moderate to severe bleeding. The correct answer is 2. As the hemophilic infant begins to acquire motor skills, the risk of bleeding increases because of falls and bumps. Such injuries can be minimized by padding vulnerable joints. Aspirin is contraindicated because of its antiplatelet properties, which increase the infant's risk for bleeding. Because genitourinary bleeding is not a typical problem in children with hemophilia, urine testing is not indicated. Although some bleeding may occur with tooth eruption, it does not normally cause moderate to severe bleeding episodes in children with hemophilia. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The primary healthcare provider prescribes an amniocentesis for a prima gravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Barr body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. When fetal lungs are mature, the ratio should be 2:1. Bilirubin indicates hemolysis and, if present in the fluid, suggests Rh disease. Red blood cells should not appear in the amniotic fluid because their presence suggests fetal bleeding. Barr body determination is a chromosome analysis of the sex chromosomes that is sometimes used when a child is born with ambiguous genitalia. When preparing a multigravida client at 34 weeks gestation experiencing preterm labor for the shake test performed on amniotic fluid, the nurse will instruct the client that this test is done to evaluate the maturity of which of the following fetal systems? 1. Urinary. 2. Gastrointestinal. 3. Cardiovascular. 4. Pulmonary. The correct answer is 4. The shake test helps determine the maturity of the fetal pulmonary system. The test is based on the fact that surfactant foams, when mixed with ethanol, the more stable the foam, the more mature the fetal pulmonary system. Although the shake test is inexpensive and provides rapid results, problems have been noted with its reliability. Therefore, the lecithin sphingomyelin ratio is usually determined in conjunction with a shake test. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait, asking another staff member to stay with the client, or saying nothing is not helpful. For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion. 2. Chills and fever. 3. Fluid overload. 4. Meconium-stained fluid. The correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, The nurse should monitor the client for signs of exhaustion, as well as dehydration. Hypotonic contractions, which are painful but ineffective, may be occurring. Oxytocin augmentation may be necessary. Chills and fever are manifestations of an infection and are not associated with prolonged latent phase of labor. Fluid overload can occur from rapid infusion of intravenous fluids administered if the client is experiencing hemorrhage or shock. It is not associated with prolonged latent phase. The client's membranes are intact, so it would be difficult to assess meconium staining of the fluid. Meconium-stained fluid is associated with fetal distress, and this fetus appears to be in a healthy state, as evidenced by a fetal heart rate within normal range and good variability. A 30-year-old multigravid client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, when explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.